This is CGTN, China Global Television Network.
Despite progress being made toward vaccinating the world against the coronavirus, the next big plague is coming. Are we ready for that new pandemic? I'm Mike Walter in Washington, D.C. Let's take it full frame.
Knowing COVID's origin can help us prepare for the next outbreak.
My thesis is that pandemics are not inevitable. We should really, really invest in preventing the next one because it's not going to be another 100 years before it shows up.
那如果我们要想很好的去保护我们人类，不再发生就下一次新发传染病大爆发，那我们必须去提前去了解在自然界野生动物携带的这些未知病毒。
Most experts agree its source was natural, not one created in a lab.
There's some remote possibility of that, but that seems like the least likely origin story. And the most likely origin story is something having to do with animals and humans interacting through agriculture, most likely.
Researchers are looking at bats as a possible source.
There is a 97% genetic agreement between a SARS-like coronavirus that bats carry in Yunnan with the human SARS-CoV-2 virus that causes COVID. They are very, very closely related.
But the origins of COVID-19 are still unclear.
Before the Chinese had figured out what the disease was, it was already all over the world. Doctors don't start to be surprised until they see a lot more cases, right? So yes, probably started in Wuhan, but it could have been somewhere else where there were just a few cases.
Forcing us to rethink our relationship with nature.
这些病毒就在自然界存在着，你承认不承认它都在。如果我们不去研究，还会有下一次的爆发，那我们都不认识它们。
But the bottom line is we often don't know the origins of diseases.
The next pandemic, next.
Every few years, pathogens infect people around the globe. There was SARS in 2003, swine flu, that came about in 2009. Ebola, that occurred in 2014. Then Zika arrived in 2016. And as we all know, the world was ravaged in 2019 by COVID. So what's next? And is the world ready? I talked with Maureen Miller, an infectious disease epidemiologist at Columbia University in New York City.
I met with Maureen at the school's Barnard College. For nearly 30 years, she's researched contagious viruses.
I started as an HIV prevention researcher. So there's a global pandemic right there. And we don't think of HIV necessarily as a pandemic, and it's certainly a different kind of pandemic than the one we're experiencing right now, because it's a long, slow process. This one, boom, bounced around the world in really a matter of a month. So this one works very differently than that one, but still there are shared ideas in terms of how an epidemic, how a pandemic works.
You probably saw this freight train coming and started to tell people early on, but it's hard to get across that point of view, isn't it?
People did not want to hear it at that time. It just seems so unbelievable. It's like science fiction. And interestingly, the first people to reach out to me were hedge fund managers and multinationals. And they said, okay, tell us the unvarnished truth. We want to know really how long should we expect this to last? And dead silence at the end of the phone. Because my initial estimates were 18 months. And I'm turning out to be wrong. It's going to be longer than that. I thought by perhaps the end of this year we would be settled, and parts of the United States will be settled by that time. Parts of Europe will be settled by that time. Meanwhile, we've already surpassed the number of deaths this year globally compared with 2020. So a lot of people are dying, a lot of people are getting sick, and a lot of people are not yet getting vaccinated or even have access to the vaccines.
Give me a sense, somebody who's in your field who understands all of this, and I think we're starting to understand it, even lay people like myself. When did you first say to yourself, man, this is going to be huge?
Beginning of January of 2020, when it was announced to the world that there was a severe acute respiratory infection circulating, boom, that's bad news. Already it means it's airborne. There were different areas where it was popping up. It was sequenced in record time. China does not do anything rashly. This was a consolidated, thoughtful action with the beginnings of a recognition that something really, truly awful was happening.
It's interesting. I remember working in Wuhan's shutdown, this huge city, so many people. And I remember turning to colleagues and saying, you could never see that in the United States. And then we saw it here in the US. I mean, this concept of a lockdown, did you kind of see that coming as well?
I saw the need for very serious and rapid action, and I was disappointed not to see the seriousness of this virus addressed for quite some time.
Were you also disappointed that scientists all of a sudden became vilified? I mean, that it became politicized, of course.
Of course, because meanwhile we just chug along and do our work in the background, and things happen or are under control. They don't get to above the radar so that everybody knows about it. And then the big chance when we know, when we have information, when we have some answers, when we have the beginnings of a clue as to really how to deal with this situation, then all of a sudden we're the bad guys. That was hard.
Maureen is internationally recognized for her contributions to infectious disease research and policy. She's worked closely with international scientists, including those in China, to help prevent the next pandemic.
We've had Ebola, we've had MERS, we've had SARS, but we've never really, I mean, you go back to the flu epidemic in 1918 here in the United States, which just coursed through the country, two waves actually, killed so many people. But it was so far removed that people kind of felt like, that's just not going to happen. And people in your field have been telling us over and over again, and we need to be cognizant that this could happen. How difficult was it to be in your profession and keep telling people, look, this could happen, and then to have it actually happen, and then, as you said, people ignoring the science?
Yeah, no, 100 years ago, I mean, we didn't really, as an epidemiologist, I didn't really know about the pandemic in 1918 until really the early 90s, when people had started, hey, wait a second, something horrible happened. And, I mean, everybody has family stories where there's holes or something, or there was a lot of shifting of children that, once we started talking about that pandemic, it's, wait, this was something really awful, and we had never heard of it. So I think from the 90s on, infectious disease epidemiologists in particular really started to worry about it. But the World Health Organization already knew that animal to human virus transmission was going to be a problem and could potentially cause pandemics in the future 70 years ago. They set up a network of hospitals and laboratories to monitor the globe to catch at early stages some kind of pandemic threat.
And the zoonotic viruses are more of a threat now, aren't they? I mean, we're encroaching more on the territory of these animals. There's the merging of both of us. The potential's there, right?
Oh, it's happening faster and faster and faster. And that's a hallmark of the 21st century. We've had already the SARS pandemic of 2003. the huge regional Ebola epidemic. I mean, those are unheard of in the 20th century. So it's only going to happen more and more quickly and cost us both in politics and in economics. I mean, if we have to shut down again, it's going to be horrible. So I am trying with others to prevent the next pandemic from happening, and I believe we have the tools to do that.
And curiously enough, as people are getting vaccinated for COVID-19, the next pandemic could actually, the threat's out there now, right?
Absolutely, absolutely. And we don't have a clue right now which part of the world it's going to come from, what kind of virus it's going to be. As we've experienced with COVID-19, respiratory viruses are the worst in terms of being able to move quickly around the globe now that we're so interconnected. So China and the rest of the world needs to cooperate in a positive way. And there have been scientific relations with the entire world and China since the 1970s. It's just now that things are getting even more complicated.
You say in a positive way, but it seems to me that, I'm a China watcher for almost a decade now. It seems like it's very easy to vilify China and point fingers at China. And China's always seen through this negative lens in the West. That's not the best way to get cooperation and to get people working together. I mean, what suggestions would you make?
I absolutely agree that politics has made the relationship adversarial. Public health scientists, however, have worked collaboratively and would be working collaboratively right now if that was at all possible. There was just an article in The Lancet of a collaborative group from China and the United States saying, look, we work together really well. We want to continue working. This is scary stuff. We want to not have a pandemic, and we could prevent it.
As scientists look for the exact origin of the coronavirus, one claim is that it originated in a Chinese laboratory. Although several scientists around the world dispute that hypothesis, including Maureen.
You've worked with scientists in Wuhan. You've heard the theories that it was a lab leak that caused all of this. You and I have been talking about zoonotic, the jump from animal to humans. What's your sense of how we got to where we are today?
I think the reality is that most pandemics in human history have resulted from animal to human viral spillover. I mean, that's just the nature of pandemics. The idea that the virus, which was first discovered in Wuhan, actually originated in Wuhan is unlikely. There is a 97% genetic agreement between a SARS-like coronavirus that bats carry in Yunnan with the human SARS-CoV-2 virus that causes COVID. They are very, very closely related. But in evolutionary terms, that's pretty far apart. Yet, this bat was found in Yunnan. There's evidence that suggests that it may have been circulating in southern China in 2015, 16, 17. The virus that they were finding in Wuhan was already 2 mutations away. So it was farther away. So there's evidence that it was in southern China. Why was it discovered in Wuhan? Because they have the scientific expertise to be able to identify it. They have Shengli Shi, who is fondly known in China as the Batwoman. So there's all this medical expertise. It's the scientific center of China.
You talked about Dr. Shi. She was quoted in the New York Times because she's been under a lot of attack about this. And she said, how on earth can I offer up evidence for something where there is no evidence? It really is kind of difficult for the people who work in that lab to try and defend themselves when it's just this accusation. And yet you have a lot of people like yourself who say, no, it probably jumped from an animal to a human.
And most scientists also agree with that idea. That's not published a lot in the media. There is a call to determine, to have an investigation at the Wuhan Institute of Virology I think that would be wise to be able to do that, but honestly, I don't believe they would be able to find anything because the other theory is so much more likely, and that's the one that's getting pushed aside right now, that it was a zoonotic spillover from an animal to a human. And in fact, an international group of scientists suggest that, yep, it went through an intermediary animal, but really where it got adapted was in human populations, and it just moved and moved. Dead-ended someplace, an old person died of pneumonia in some remote area and didn't transmit it to somebody else. Her son didn't know he was infected and transmitted it to everybody else he worked with, but nobody got sick. I mean, that's exactly what's happening now with the coronavirus. So of course it is likely that it happened that way in China as well, and then moved to Wuhan where it was discovered.
Maureen believes one way to prevent outbreaks is to monitor people where disease spillover actually happens instead of waiting for sick people to show up at a hospital.
By the time people make it to the hospital, is it already too late?
It's too late. Again, it's the influence and persistence of the doctor to convince authorities, but even more than that, there's an outbreak. An outbreak has already occurred. People are sick. People may be dying in a remote area. So it takes a long time to get to a sentinel hospital like the one in Wuhan. So people were likely sick and dying long before it was found in Wuhan.
Do you think that this is going to spark a new interest, do you think?
Oh, absolutely. Absolutely.
You're already seeing it, you think?
You're seeing it more in medical schools. People want to be helpful, and they've learned that the helping professions are really important. But I think as science begins to dominate again, more and more people are going to be inclined to become epidemiologists.
And you've always had a love for this. Has it heightened more because of the pandemic, in a sense?
I'm bad. I can't resist a good epidemic. I really can't. So I would say no. I'm more horrified at what pandemics can really do, having never lived through one. But no, I'm a lifer. I'm into this, and I'm going to stay working in this field and hopefully prevent the next one.
And while the next virus outbreak is likely already lurking, Maureen believes there is a simple strategy to prevent it.
So what's the big concern right now? I mean, you're talking about variants, and we keep hearing that they keep mutating and changing, and that's the nature of a virus, I guess. What's your greatest fear?
My greatest fear is that right now we have almost 8 billion people in the population. Back of the envelope figure, at the outside, 1 billion people have been infected or vaccinated. That leaves 7 billion more people for this virus to churn through. I worry that we're going to get variants that will evade the current vaccines that we have, and that we may not be able to keep up. That scares me, that keeps me awake at night, and it's going to kill people, a lot of people that didn't have to die. At this stage in the pandemic, that's the answer we have. So people wear masks, people social distance, and people get vaccinated. Those are the tools we have at hand, and that's scary. My thesis is that pandemics are not inevitable. We should really, really invest in preventing the next one, because it's not going to be another 100 years before it shows up.
Let me close with this question. Looking back on all of this, and with the knowledge that you had going into this, and seeing just how scary this was going to be, what's your biggest fear now in terms of like us not getting it? And when I say us, I mean policy people and leaders. And if they were to sit down with you and you were to give them like, look, here's my list of the 5 things you guys have got to think about going forward, what might that look like?
That list is put funds towards prevention. There are all kinds of scientists around the world who are interested in prevention. That's why Sheng Li was amenable to creating something so bizarre that she hadn't even thought about it, an antibody test for humans based on a bat virus. What? So there are people who are very interested in never seeing this happen again, who have the skills to make sure that it doesn't happen again. We are not funded. So that's number 1. And number 2, pandemics are not inevitable. You have to do the right things. I mean, do you really want to prepare and respond and then have that whole response just crumble to the ground because it's overwhelming. It is overwhelming. The best cure to a pandemic is prevention. It will always be the case. It will always be the case that prevention is cheaper than allowing a disease to happen. Because the cost of disease is not just the disease itself, it's the impact that it has on economics, on politics, on human dread, quite honestly. So yeah, prevention is the cure. It is the only cure, and we do have to work together as a global community.
We'll leave it there. Thanks so much.
Okay, great.
How can we prepare for the unknown? After all, how many of us predicted the coronavirus pandemic? The challenge is to prepare for a future infectious disease threat that is unexpected, or worse yet, entirely unknown. But the answer lies in the concept of international experts from diverse backgrounds coming together from scientific labs to remote caves. It will take a global team to win the war on infection.
The streets of Wuhan, China were quiet during the coronavirus outbreak, with the city under lockdown.
和防控方案要求，做好医务人员培训、药品器械适时准备。
2019年12月30号下午接到样本以后，那我们的团队首先就对这个样本，当时叫不明原因肺炎，我们对这个样本首先开展了冠状病毒的研究，因为我的实验室是长期做冠状病毒研究的团队。那么同时呢，我们也对这个样本进行高通量测序，以及病原的分离。那么我们在很短的时间内，就首先就确定了这些样本里边有新型的冠状病毒的感染，那么也获得了它的全基因组序列，那么证明这个病原和已有的我们已知的病毒的序列都不一样，所以我们当时把它命名为新型冠状病毒。
Shizheng Li is a top Chinese virologist. She heads a group that studies bat coronaviruses at the Wuhan Institute of Virology, which has earned her the nickname Batwoman in China.
那我们知道，自然界其实这个蝙蝠种类很多，还有其他野生动物的种类都非常多。那么我们现在发现的这个未知世界存在的这个未知病毒，实际上只是冰山一角。
Many scientists believe the source of the COVID-19 infection was a wild animal and are closely looking at bats.
那如果我们要想很好的去保护我们人类，不再发生就下一次新发传染病大爆发，那我们必须提前去了解在自然界野生动物携带的这些未知病毒，提前预警，并且能够储备一些检测、预防或者治疗的药物和试剂，用于将来的这种预防和防控。
Bats, rodents, and other wild animals have a history of passing potentially deadly pathogens on to humans.
People don't remember that HIV actually is a spillover event, and most of the diseases that we have that surprise us, take us by storm, even cause epidemics and pandemics, are those that spill over from animals.
The 2002 outbreak of Sars and the 2013 Ebola epidemic are both linked to bats. A toddler from a remote village in Guinea is believed to have been West Africa's first case of Ebola.
We didn't used to worry so much about Ebola because we thought that's something that happens in small villages and those people don't leave there and it doesn't really get out. That was a mistake we made, right? Our own naivete allowed something terrible to happen in West Africa because we didn't expect it there.
As the world watched the Ebola outbreak unfold, Doctors Without Borders responded.
We arrived here yesterday. We are following him very closely. Still having a lot of symptoms, vomiting, diarrhea, but it's not getting any worse for now, so I'm still optimistic. We had to change the perfusion, but of course it's not dripping fast enough, so it's still there. So I still need to go in to make it faster, because otherwise it will take the night.
Robbie, R-O-B-I. Thank you. Are we ready, guys? We can go? This amount of liquid was supposed to be finished 1 hour ago, so it's going too slow. You want to change the bed?
Today he had the complication because we did some laboratory tests. We found some results that were not going very well. So one of the symptoms of Ebola, of the signs, it's a low amount of electrolytes in the blood, and this child has low potassium that can lead very quickly to death. So now we are really following the fluids very carefully because we are replacing potassium. We are making shifts among doctors to go in quite regularly to follow up the condition of the kid and the perfusion, to be sure that we are not putting him in extra danger. In an Ebola context, the number of children that you see dying, it's heartbreaking. It's very difficult, very difficult.
Researchers have learned that by partnering with a strong, efficient local effort during the early phase of an outbreak, an epidemic could be prevented.
With the new setup that we have in the center, it's the quality of care that we can provide is much better. So we're not physically in the high-risk area, but we have this plexiglass corridor. We can be there, we can give some advice to our colleagues that are inside, and we can really follow up the patients more closely. Can you give him some water? Thank you. We can kind of follow up the patients over time and see if we need to adjust the treatment or if you're doing well. To see a child that is walking like this to go out, it's a very good sign.
The influenza epidemic that swept the world in 1918 killed an estimated 50 million people. 1/5 of the world's population was attacked by the deadly virus.
One of the most chilling aspects of the influenza outbreak of 1918 was, of course, the realization that nobody knew what was killing them. They had no identification of what this bug was. People called it influenza, but they didn't know what it was, how it was transmitted. They had some ideas, but really, modern medicine was really in its infancy even 100 years ago. And the disease would come on very, very quickly. It uncharacteristically targeted young, healthy adults.
The exact origin of the 1918 pandemic influenza is still not known. It has been suggested that at about the same time, an avian influenza virus had crossed the species barrier from birds to pigs and on to humans.
The birds here are used for education, and they help us remember that we're connected to all places around the world. These birds can migrate thousands and thousands of miles, and with them they can bring along things like avian influenza and things like that as they migrate.
Because of the global movement of animals, whether through natural migration, as a food source, or through the pet trade, a wide variety of pathogens can be dispersed at an extraordinary rate.
Your neighbor might have just come from all of these different places, and inadvertently brought something with them. Our planet's climate is changing, and with those changes, we have changes in things, vectors, the bugs, frankly, that carry some of these diseases. And so where we didn't used to have certain mosquitoes or other kinds of bugs that carried certain viruses, we do have them again. This is coming to your neighborhood, I'm sorry to say, but we can do something about it. If we clear that fog, we can do something about it. We can be ready, and we can jump into action quickly, and we can save lives.
Viruses like COVID-19 can gradually evolve through mutations, which means someone previously protected against one strain can't effectively fight the mutated virus and they become sick. When it comes to the flu virus, scientists try to predict which changes are likely to occur.
They take a bit of the flu virus that the body will recognize, and they inject those few proteins into the body. The body mounts a response against the vaccine, and then it's ready when the real flu strikes. The problem is that those proteins can change. It's a bit like this overcoat. You've taught the body to recognize a brown overcoat, but now the person is wearing a black overcoat, and the body doesn't recognize that as an intruder. What scientists are trying to do is to manufacture a vaccine against a part of the flu virus that remains constant. That would give us what's called a universal flu vaccine. So although the overcoat changes a lot, there may be parts of the flu vaccine that are conserved from year to year and from strain to strain.
Numerous variants of the virus that causes COVID-19 are being tracked to check the efficacy of the vaccines that are currently available.
We can't keep doing the same things over and over again. We can't keep responding to epidemics by flying in, if there's a vaccine, bringing the vaccine after the epidemic is almost over. We need to get in front of these problems and understand them better. And we can't do that if we don't bring the animal groups together with the human health groups to say, okay, these things are living along, bubbling along in their natural hosts, not causing their hosts to be too sick. But as we grow our human populations, we push out into wild environments, or we push into this situation where our urban environments are taking over huge areas and the animals have no choice but to live with us. We are starting to live in this close contact with them, and if we don't understand better across species and the environmental drivers that push things to be just a virus into being a disease, we're not going to ever change. We're just going to be responding after the fact to these horrible outbreaks.
这些病毒就在自然界存在着。 你承认不承认它都在。如果我们不去研究，还会有下一次的爆发，那我们都不认识它们。
We have an understanding of what's out there. We have DNA and RNA, and we can understand the very makeup of the flu virus or the HIV virus. We know how it reproduces. We know what it looks like under an electron microscope. But it's still challenging for so many of these reasons to actually get on top of the disease. And we've had some remarkable successes, right? So smallpox has been eradicated, polio has been eradicated in most Western countries, and it is really a disease that we can vaccinate against. We no longer see children dying from mumps and measles. Rubella has gone away. And these are all great victories of modern medicine.
Welcome back. The world is gradually moving toward vaccinating against COVID-19. But what about preventing the next pandemic? How important is cooperation between China and the United States in getting ready? Even during the Cold War, the U.S. and the Soviet Union cooperated in eradicating smallpox. The two countries may have had their differences, but they took a cooperative approach to disease prevention. I talked with Deborah Seligsohn, who teaches at Villanova University in Philadelphia, about how these two countries could come together on global health.
Good to see you. I guess we do what? This? That's the right way.
I met Deborah in Philadelphia, near Villanova University, where she's an assistant professor of political science. Her research focuses on Chinese politics and U.S.-China relations.
There's a need to understand what's going on in a country, understand what the politics are, understand what the domestic interests are that are pulling leaders in one way or another. There's a mistaken belief in the United States that, oh, it's an autocracy, so the leader decides everything. And that's not true. It's a big country with many people in the Chinese Communist Party and quite a few in the Politburo. And you have large state enterprises, you have large provincial governors and other people who all have push and pull in different factions. And so it's complex, and you need to be paying attention to it because there is a politics there. I don't actually think politics is deeply rooted in culture. If it were, we would all still be under monarchies, right? Because we were 300 years ago. But politics is politics, and it's very complicated in every single country. And just trying to understand the politics of a single large city in the United States would be a lifetime's effort, right? So, yes, the fact that we lose track of what's going on in China at the higher levels. I mean, there are a ton of people working in the State Department and many other foreign affairs agencies within the U.S. working on it every day and know a lot that can be shared. But people at the top have only so much of an attention span, and the U.S. is trying to focus on the whole world, whereas most countries in the world view the United States as their top issue, and if not the top issue, it's definitely going to be within the top three. So the attention is often asymmetrical, I think. But I think what I would recommend is it's a difficult time with China, and there are a lot of serious issues, and those aren't going to go away.
Deborah has worked for several years in China. Her research focus is on public health, energy and environmental politics in both China and India. She believes global cooperation on public health issues like HIV, AIDS, and COVID is vital.
A virus can be hanging around and being spread without our knowledge for a lengthy period of time. So we don't even really know when this started or how it started, right?
Right. And Michael Osterholm, in his book, and he's like one of the foremost epidemiologists in the U.S., says we still don't really know if AIDS came from chimps or monkeys or other apes. So, yeah, I think people have a bunch of theories about the specific origins. And yes, that came 35 years or so after the disease was identified. But also, yes, people think that there was this disease in West Africa that was called SLIM, that was people with HIV/AIDS, because the other thing I think people don't really understand is how exponential growth works, right? So one of the issues that happened in New York, it happened in Milan, it's happening in Florida, is that when the number of cases is low but rising, you can suddenly see this very rapid uptick. But the thing that people forget is there's often this slow growth before the curve starts to go this way. The slope of an exponential curve is kind of like that. And so this long period of slow growth, if you're talking about a disease like AIDS, can be decades and decades, right? If you're talking about a disease like COVID, it can still be weeks or months. So we now know, for example, that COVID was in many places in the United States back in December, right? Before the Chinese had figured out what the disease was. It was already all over the world. And that isn't surprising because when you have a few cases, it looks like pneumonia. For mostly it's elderly people going to the hospital. Doctors don't start to be surprised until they see a lot more cases, right? So yes, probably started in Wuhan, but it could have been somewhere else where there were just a few cases. It's very hard to know.
But I want to get your thoughts about this theory that it's man-made.
I follow what the virologists say. I've read the peer-reviewed papers, and I think that's a more useful way to think about this. And the basic framework hasn't really changed since the big paper in Nature last March that's been cited now thousands, if not tens of thousands of times, that sort of says, yeah, there's some remote possibility of that, but that seems like the least likely origin story. And the most likely origin story is something having to do with animals and humans interacting through agriculture, most likely. So as far as I can tell, none of the actual sort of experts on this, the virologists, the evolutionary virologists, the people who look at this kind of stuff specifically, have seen new information that changes their mind. They all want more information to figure out the origins. But the bottom line is we often don't know the origins of diseases. That's actually quite common. We still don't really know where Ebola comes from. And whether we can treat it, whether we can prevent it, is not that related to whether we know the origin. The reason we really want to know the origin is in thinking about the next pandemic.
And while COVID-19 is still raging, researchers believe global cooperation is needed to prevent the next pandemic. But with scrutiny over COVID's origins, some experts say it's a distraction from the real work that needs to be done.
Of course, we're talking about the current pandemic, but the next pandemic is just around the corner. I mean, we know that. When it happens, we don't know, but we do know that there'll be another. Global cooperation is going to be key to that. These accusations can impede that. I know you worked in the State Department, you know about diplomacy, you know how words can kind of inflame things. What are your concerns about this?
Well, so I think the US and China absolutely have to work together, both to get this pandemic actually under control, right, to vaccinate the world, and to do the kind of monitoring that we actually need for the next pandemic. And what's particularly surprising about how badly we're doing cooperation right now is that we have this long history of doing it well. So the US and China collaborated to develop China's influenza surveillance capacity. So many epidemiologists still think that the most likely, really catastrophic pandemic, perhaps more catastrophic than COVID, is still likely to be an influenza pandemic. And with influenza, we worked with the Chinese to really help them set up nationwide surveillance where they collect samples every year and analyze them and send the data to the WHO. And a pretty large percentage of the information that the WHO uses each year to figure out what should be in the annual flu vaccine actually comes from this Chinese surveillance, because you have this enormous country with so many people, so many chickens, ducks, pigs, that it just is going to be where a lot of new influenzas arise. Not all of them. H1N1 arose in North America, but an awful lot of new variants. So that's kind of a history that we have where we really do work together well. And we need to be doing that for coronaviruses. We've had 3 new coronaviruses in the 21st century, SARS, MERS, and COVID. And there's no reason to think that's going to be the last of them. Many people say, oh, the worst one is going to be the one that kills the most people. But the truth is, when things have the fatality rate of a SARS or MERS, people very rapidly go into their houses and stay away from each other because they're so terrified. COVID actually hit this weird, for a virus, a sweet spot, not for us so sweet, where the fatality rate is still awful, but it's low enough that a lot of people keep saying, well, it won't happen to me. And of course, it transmits before you have any symptoms, the asymptomatic transmission, which was not true of SARS or MERS, and which is true of influenza. So we absolutely have to be working with the Chinese on better surveillance to prepare for the next one. We still don't have good antivirals to deal with coronaviruses. We don't yet have a universal influenza vaccine, which we need to prepare for an influenza pandemic. So there's a lot of work to be done, a lot of great scientists in both countries, and we really need them to be working together.
In 2002, a novel coronavirus was silently causing deadly pneumonia outbreaks, which later became known as SARS in China. It would infect more than 8,000 people globally and led to nearly 800 deaths.
Deborah, what I find unique about you when you talk to people, they can tell you about COVID-19, but you lived through SARS in China and now COVID-19. Compare the two for me.
I do think the fact that the Chinese had lived through SARS, I mean, it's become very obvious. The Chinese, the South Koreans, the Vietnamese, the Thai, countries that had lived through an outbreak of SARS or MERS did much better in the early stages of the pandemic than countries who hadn't, right? That the citizens were prepared, they put on their masks, they started washing their hands frenetically, they were very accommodating of social distancing rules, they were prepared to have the kids sent home from school. All of this was not a surprise to them, and they responded very well. And I think experience was the huge difference. In the United States, I think we always assume that there's just going to be a medicine that's going to get us out of our problems. And to this day, people just assume if I get sick, there's some good cure. And even though the treatments are way, way better than they were a year and a half ago, they're not great. And no one should want to get COVID. And of course, we have a great vaccine, so people should be using it. I will say vaccine hesitancy is also something that exists in both countries. That isn't unique to the United States.
Both China and the U.S. have worked together on the global issue of climate change. In 2014, the U.S. announced it would share research, experience, and information jointly with China to contribute to the Paris Climate Change Agreement.
But you've seen firsthand cooperation between these two countries. I mean, it really kind of pushed things across the finish line in Paris when it comes to climate. And I know that's something you care passionately about. So you can see when these two countries work together, it can have a positive impact. So give me your experience from Paris, the takeaways, and how you might extrapolate that out given COVID.
Well, what's really interesting is Secretary Kerry has been very upfront saying, you know, we're going to treat climate change separately because it's a global problem, and therefore we have to work with China regardless of these other issues, in his role now as the special negotiator. And I've been disappointed that we simply haven't said the same thing for COVID and public health. It seems to me the issues are quite similar in that we clearly need a global solution. No one is safe till everybody is safe, right? And you can be someone who never travels around the world, and yet you are vulnerable to anyone traveling anywhere. So that hasn't happened, and that's been a disappointment. But what I would say is, in the past, science cooperation has been one of the sort of cornerstones of the relationship. It began earlier almost than anything else, pretty much immediately after the original ping-pong diplomacy of the early 70s. US government started sending scientific missions to China to look at what could be done together. And public health was very rapidly identified as an area where we could really work together. And that was in significant part because of this idea that we need to be working together everywhere to protect the world, but also because the Chinese actually had a lot of capacity to do things like collect data on outcomes from large groups of people. It's a big country with lots of people and lots of doctors to collect data. And so things like preventing birth defects, one of the most important studies ever done was done in China way back in the 1980s. And huge heart disease studies, diabetes studies. We've been working with the Chinese on health issues pretty much continuously. I think one of the problems of the last few years has been that the US really has stopped recognizing the importance of that. There was a real sort of pullback of interest in this kind of thing during the Trump administration. There also was a lack of understanding that while the previous relationship had been very much a student-teacher relationship with the US coming in with all this expertise, all this equipment, Chinese now come to a US lab and say, wow, your equipment is older than ours. What is it you have to offer? And depending on the field and the subfield and the sub-subfield, maybe the learning has to go in the other direction, or maybe you're collaborating among peers. But we collaborate among peers all over the world, right? We collaborate with Europeans, with Japanese, with Koreans, with folks in South Africa or in Brazil or wherever. And what we need to do is establish a new kind of peer relationship. So I think one of the problems has been that in the United States, there was this view that China was just sort of this giant sponge learning stuff. And then that led to all this paranoia about intellectual property loss and all kinds of things like that. In the COVID case, it led to us offering to help them with things that we should have known they already knew how to do. You know, they needed this help during SARS, but it was 17 years later and things were different. So I think there's both an assumption that all China is doing is taking, which isn't true, and also this is total misunderstanding of where the forms of cooperation can actually be beneficial. And on the Chinese side, because the relationship was framed as this teacher-student relationship, now that they no longer are the students, I think people may not see what the advantages are of global cooperation, of what the interchange with colleagues actually would be, and some sense, especially on the government part, that maybe we can just turn inward and don't need to share information. But the incredible speed of scientific advance in the 20th and 21st centuries is because we do share globally, and scientists communicate in such a global scientific network. And so that would be a real shame. And I really do hope that the two countries can learn to reframe and rethink how the relationship has to be going forward. And what I can tell you is, talking to people doing health on the ground in China, they want the relationship to continue. They're still very open, the scientists, whether in the China CDC or in academic institutions. And I hope the Biden administration, starts to become aware of that and do some outreach, because there's real interest in China. And they know the problems that we still have, looking for the next pandemic, coming up with some antivirals that are much more effective for whatever new viral outbreak comes out. It's always going to take a little while to come up with a vaccine. You need to have treatments at the ready for people who get sick. And that's an area where the science still has a lot to do, and everyone in the world should be working together.
Terrific. Deborah, thanks so much.
You're welcome.
That's this edition of Full Frame. Our thanks to Maureen Miller and Deborah Seligsohn for their perspectives on the next pandemic. If you know other visionaries you'd like to see on our show, email us at fullframe@cgtnamerica.com or tweet us your ideas at fullframecgtn. From all of us on Full Frame, thanks so much for watching.